commiserate with those that are experiencing maybe the effects of the lockdown, those that are in hospitals and those that are at home. The 42-day lockdown is soon expiring, and we pray for those that have been adversely affected by the effects of the lockdown. Welcome once again, and my guests are already in the studios. We have very many issues to look at because it's quite an eventful week. It's been quite eventful. We, of course, like I said, we are looking at the 42-day lockdown that will be expiring in just 5 days. And again, there are other issues. Uganda sent a team to the Olympics. That's another highlight. And we pray for the best to come out of the Tokyo Olympics. We pray for our team. And again, on the political scene, in Parliament, the Prime Minister this week presented a government report on the progress of the interventions in the COVID pandemic. And of course, we'll be also looking into what the Prime Minister presented. Was it really satisfactory? How the parliamentarians, the legislators responded? And very many more issues. But the highlight of this week is the 200 million shillings that was extended to members of parliament to buy vehicles. And that's when the question of priorities arise. The public section of the public is asking, are the priorities right or not? Of course, early in this week, there was also an issue of priorities relating to the funds that were collected in the last year, the 24 billion Ugandan shillings that was collected out of the fundraising drive, and later it was sent to buy double cabin pickups, when actually people think that the priority should be the ambulances that would help people in this time of the crisis. My name is Tim Apollo, and in the studios this morning I have the State Minister for Tourism, Honorable Martin Mugara Bahinduka is already in the studios. Speak to our viewers, say hi and good morning.
Thank you, Apollo. Good morning to the viewers.
Well, you'll come to the show.
Thank you, sir. Thank you.
I hope tourism is one sector that really suffered the brunt of the COVID-19 pandemic.
Yes.
How are you faring?
No, it did indeed, because you can imagine we dropped from around 1.6 billion to around $470 million. So yeah, it was a drop, but I thank His Excellency because at least he kept it open for the foreign tourists. Yeah, so we are managing.
You are managing.
Yeah.
And it looks like this second lockdown did not affect you so much because foreign tourists are allowed to come in.
No, definitely it did, because domestic tourism was affected. The locals are not allowed to move, and they've been a big factor in the sector. Yeah, so it has affected us to a certain extent, but at least we are managing, because foreign tourism is ongoing for now.
You are managing.
Yeah.
Well, I forgot to congratulate you. You are new in that ministry. Congratulations, Honorable.
Thank you, Mr. Apollo.
Well, Honorable Martin Mugara Bahinduka is the State Minister for Tourism, and in the studios again we have Ms. Fatia Kiangi, and she is the Deputy Executive Director, CEHUD, and this is a civil society organization, the Center for Health, Human Rights and Development. Welcome to the studios.
Thank you very much, Apollo. Good morning, viewers. Thank you for dedicating this morning to this dialogue.
How is it going at CEHUD?
It's all going well. We are progressing. We are trying as much as possible to remain aboard with the issues that we have to speak for, the issues that affect the public, and more so the issues that affect the most disadvantaged people in our community. So, yeah, we are trying to be creative and adaptive to continuing to serve the country.
All right, Madam Fati, allow me to congratulate you upon that successful petition that now empowers government to rein on private health facilities and hospitals that have been overcharging patients during this crisis of the COVID pandemic.
Thank you very much, Apollo. We are also happy, we are excited with that court judgment. And also the fact that it was passed in record time. I think it's a precedence not just for Uganda but for the region and globally. And we really, really hope, we are also happy that we are seeing government is taking some steps to do the negotiations with private health facilities in terms of the cost for COVID treatment and management. But we definitely hope and look forward to regulation coming to really take care of this issue. I think the regulation around costs is not just, yes, it is, we brought it in the spirit of COVID treatment and management, but I think there are quite a number of lessons for us in the future, because we are not saying this is the only time we are getting pandemics. We have got epidemics before, and hopefully it will be a sustainable solution for this problem of high costs of treatment and management. But I also think that for us to have a more sustainable and permanent solution, in addition to regulating the cost of treatment and management, this more sustainable solution is for government to strengthen our own public health facilities, because then private facilities will not have the luxury to overcharge, because then the population will be able to be served through the public health facilities. Yeah.
Well, how soon should we expect that to happen, the regulations to come out? I think you have information about it, and hopefully we see that sorted.
We may not know exactly how soon, but we know that at least the Ministry of Health is taking leadership, and I think the ministry is speaking to the Medical Council about the same. So we can only hope that it will be sooner rather than later, because also this is the second wave of COVID-19. We cannot guarantee that we are not getting the third wave, and as you have heard, probably like me, the third wave could even be more devastating. So if it comes here and we have not sorted that issue of the costing and pricing of treatment and management, we are, I think, going to see a much more frustration in the population. So the earlier the regulation comes, the better.
Well, that's impressive. Honorable Minister, comment. Don't you think civil society now proved that they're actually awake to realities that affect our people through that petition?
No, true, and I want to congratulate my sister Fatia. And also to be able to work in government, to take more interest. So I think it was good. But going forward, as we prepare for the third wave, government has come up with measures today that will, for instance, we had an issue to do with beds. I know that in this quarter, of course, the target was to have around 2,000 beds. For this quarter, we're expecting around 10,000 beds. So I think that will create more space in the public hospitals. So there is reduced pressure on the private. So someone can have a choice. Where do I get even much cheaper assistance? Secondly, to do with the issue of oxygen, because I think it's the biggest problem. A normal patient would use probably on average 1 to 2
cylinders,
oxygen cylinders, but for COVID patients, you'll use 4 to 6.
Yeah.
So you can imagine the price goes up enormously. But government has come up with a plan that is in progress now of fixing air plants, most of these, at least 15 for starters, most of these health facilities. I think that will also reduce on the prices, because there will be availability of oxygen, both for private and even for government. So I think with those measures there will be, of course, a reduction in the pricing. But I want to congratulate them and thank you so much for
Well,
Thank you, Honorable Martin.
I hope that was a landmark case. And viewers, we are talking about the petition that was filed by Sehud in court challenging government's failure to intervene in the pricing and costing, of course, in private hospitals. We were speaking of people being charged more than 10 million, 5 million, 3 million a day for patients in ICUs in private hospitals, which had also become, it was an issue. It's a big issue. And luckily, the curve went down and we are not hearing those stories again. Let's hope that will not bring laxity in you people who are in works down there and think that everything is fine.
Yeah, just like she said, of course we are preparing for third wave. Anything can happen. So I think the case is turned forward, and even this other telling you that of anything, we should be more ready than we were in this current wave. Yeah, so we are preparing for whatever eventuality comes.
Okay, as we kick off the show, good morning once again. Welcome you, our viewers. It is The Dialogue. I have on the show Honorable Martin Mugara Bahinduka, the State Minister for Tourism, and Ms. Fatia Chiyange, and she is the Deputy Executive Director, Sehud, a civil society organization. Honorable, let's look at the 5 days now to the end of the 42-day lockdown that was announced by the president. And briefly, how far have we managed? And what should people expect? Because the big question now is, what next?
True. Of course, like you said earlier when we were beginning, sorry, I know people are going through a lot, especially when it comes to the lockdown. But I think it was necessary, and it has helped. Because before the lockdown, I think we were averaging around 2,000 people testing positive a day. Now we are in the lower hundreds. So I think it has helped in one way or the other. Well, the scientists say that in case there was an opening, it could surge again. We are yet to see. I don't decide whether we open up or not. It is the scientists who advise His Excellency, and he comes up with a measure. But I think a lot has done good, and yeah, let's see, because they say probably this thing contained. I know it comes with challenges, but lives come first as well. Everyone should understand that whatever is being done is done to protect them and their loved ones. You know, it's not that government wants to squeeze people so hard. No, there is no way out. And it's not only happening here, it's happened in Kenya, it is in Rwanda, it is all over, it's been happening. So until we do enough vaccination and create herd immunity within the community, we have no way out. We have to take some of these measures to keep our loved ones alive and ourselves. Yeah, so let's hope for the best. I don't know what will come. Like I said, it is an issue of the scientists, the team that advise. I'm not a scientist. What they predict vis-a-vis what has been happening. So yeah, so let's pray for.
You're not a scientist, but you're close to power. You may have had, probably what we may expect.
To be honest, I'll be lying if I know what is going to come. So I don't really know. But it will depend on what the team comes up with and what His Excellency will. But whatever the decision is, what I believe is it is being done in the interest of the Ugandans. This second wave, the first wave was more of a joke. This second wave, everyone has lost someone close to them. I have lost a grandparent, and you look at the expense of treating, but even in public facilities, treating COVID is actually as well expensive.
Yeah.
So I think this time people have appreciated that we are dealing with a serious problem. It's not only a Ugandan problem, it's an international problem, it's not political, it is to do with life and death. Yeah. So whatever comes really. But I don't have any information, sir. That one is.
Okay. Well, on behalf of the public and the civil society, you must have been, monitoring and looking at the situation. How have we managed, and what should we expect, Ms. Fatia?
Well, from the side of civil society and the public, I think by now, what we would have expected, and perhaps what we would expect in the next 5 days, is the assessment of what have we achieved beyond generalization that yes, the pandemic, the issue, the infections have gone down. Yes, we can see the statistics, but in terms of preparedness, so or reopening or not reopening, what have we achieved within the lockdown? Okay, if the infections have gone down, to what extent have we prepared for the reopening so that we don't get the insurgents again? And opening means a lot of things. From the side of education sector, what have we done? How have we used the 42 days to prepare for reopening of schools? If the schools are to reopen anyway, it might not be that they are opening in weeks, but even if they are opening later, how have we used this particular lockdown to prepare for that? For me, that is what is important. In terms of the healthcare facilities, many issues have come up. The issues of, I think there are also very many positive things that we've achieved in the lockdown. When I was last on TV, I think it was Citizen TV, we're talking about people have picked up the morale. They know the importance of vaccination, but they can't access the vaccines because they are far from where they are, and also where the people are vaccinated. People are now in many lines, and they could be super spread spaces. But now you can, it's good that now people can walk to places closer to them to get vaccinated. And I think really if government takes that step and makes sure that yes, when we have the vaccines, they are closer to where people are as much as possible. People don't have to walk to and congest themselves around one area to get vaccinated. I think that will be good. So in terms of, then there are many issues, and I think also there is a shift. Yes, we could say that the infections have reduced. The numbers of people who are dying have reduced. I think yesterday there were about, 13?
Yeah.
But I mean, a life is a life. You don't even want to lose one person. That should be our goal. That should really be our goal. So we need to be conscious that even the 13 or even the 5 that will die, we need to prevent those deaths. But we should also be aware that in the villages, in the peripheral, we may not know a lot what that is going on, but we each have relatives in the villages, and we know what's going on, at least in our localities where we come from in the villages. District hospitals are struggling. I'm sure you hear on TV. You're covering them. They are struggling with spaces. They are struggling with what to use. The healthcare workers are struggling with PPEs. So the struggle and the challenge is still there. It is shifting. It is mutating, just the way COVID is mutating. So we need to really be careful. Yes, we might celebrate, but I think it's not yet time to celebrate what's happening in the villages. Also, to what extent have we learned from the past? We have seen that I personally lost my very close auntie, and she was under my care, and she got sick for about 3-4 days.
Sorry.
She had pre-existing conditions in NCDs. But we are preoccupied with COVID. But COVID is impacting significantly on those with other conditions. The attention has shifted. I think we should strike a balance between management of COVID and management of other conditions. You do not want to win with COVID and then lose a lot of lives because we have shifted the attention completely. We have to strike a balance. I think for me that is key. But also, again, looking at the experience of my auntie, I was one of those. I was surprised. You see, at least I have good knowledge of the health system, and I know what to do when and where and with who. But my auntie is one of those who we actually rushed to Molago, needing ICU. Of course, there was no option for ICU because it was full. We thought we would actually make it to the HDU, the highly independent dependency unit. We did not make it. She was going to die from the ambulance that had taken her. We had to rush her back to the private hospital where we had come from. So then at the other end, you're listening, even to people responsible saying, Mulago is not chasing any people. My aunt was chased. When we took her back that day to the private center, we immediately just asked them to put her in their ICU. However expensive it was, she died later that day. She spent only 2 hours in ICU. That was too painful.
Very painful.
For me, it's a challenge. In the 42 days, how many ICU beds have we put up to avoid such challenges in the future? If third wave is here, how many patients are going to be, how many families are going to be told in Mulago that please, we can't take you? How many will die from ambulances? How many, we say in India, people dying in ambulances and on roadsides? How have we used the 42 days to reduce the burden, to increase the ICU beds by a proportion, even if it's 2%? The healthcare workers in those ICUs are very tired. You've seen it. You have captured this in media. They are very tired. They are exposed. They are getting sick with COVID. They are dying. There is no special consideration. There is no place where they go. This is dedicated to them without a cost. They have families. They're infecting their families after getting COVID. In the 42 days, what is, I mean, we are planning, and I hear, I appreciate you, Honorable Martin, that yes, we needed 42,000 beds. Now we can add about 10, but from the time we anticipated the 42,000, the president put it rightly that we were slow. It's more than a year later. How come more than a year later we are still talking about achieving 10,000? You see, and I think this is the problem with public. That's why the public is losing trust. Yeah, if for example the 24 billion, the amount that was collected, if that 24 billion would come back here and the government says, okay, out of the 24 billion, we have managed to increase the bed capacity in ICU by this amount. We've managed to increase the bed capacity in HDU by this amount. We've managed to put up a special place where our healthcare workers go and do not pay and access everything there is to restore their lives when they have COVID. Public trust would definitely be there. So for me, I think those are the things, whether the president is going to open or not, the public, we want to have that update, what has been achieved in terms of preparedness.
Well, I think, Madam Fatia, I think that will come out from Martin, Honorable Martin. The Prime Minister made a presentation to Parliament, a report to Parliament this week, and probably you can briefly respond to Ms. Fatia's concern.
Of course, sorry about your aunt, and the talk has been there. Anyway, we've all had those challenges because of, well, I'll just start with the bed capacity. To be honest, COVID it has not been business as usual, not only for Uganda, for the entire world. For a country like us, before COVID, we had, I think, around 1,300 beds, generally in public and private hospitals. As I speak now, we had, by the time, and around, of course, government went all over, tried to come up with around 3,700 beds currently. But like you rightly said, the president said it was slow, and indeed it was, because they should have predicted, and and come up with solutions. Yeah, but of course now, as going into, God forbid, we don't get into the third wave. So if we progress from 3,700 to 10,000 within just this quarter, that would be a very big improvement. And then probably we can wait for the remaining to reach the 42,000. So I think if we have those in place, at least better than where we are now. And I pray that, because of course I think these beds are going to be made by Ugandans here. So many, I know we can achieve this number in a very short period of time. So I think when we have that, yes, there could be a little bit of less pressure. But like I said as well.
Do we have capacity to make ICU beds? I don't think so. I think ICU beds have more sophisticated. I think there is much more to ICU beds than these other.
No, to be honest, apart from the equipment.
We import them, not so.
No.
ICU beds.
And this is the argument. Apart from the equipment, that one we can.
Yes.
But the bedding and the rest can be done by Uganda.
Oh, yeah.
There is no doubt. I think they are costing around 1 million shillings. We don't need to import that. Ugandans have shown capacity, and they are going to do these beds. We're not going to import any. The equipment, that's another issue.
Yes.
And we are looking at it going forward. But like I said as well, the other biggest challenge is the oxygen.
Yeah.
It has been a problem. Of course, the private sector has been helping as well, but we need more capacity. There is importation of new cylinders coming in, and of course, but the biggest solution would be placing these air plants in most of these hospitals, at least all the referrals, because they can produce for the public hospitals, but also have some surplus for the private hospitals, which will.
I think, Honourable Minister, the challenge, the issue is not that you have not done something to address that issue of oxygen shortages. You have done something, because we actually recently saw some plants at national referrals and regional referrals being put up. But the question is, how fast have you responded to this particular critical issue? Because we had the first lockdown, you had that time to do all of that, and here we are in the second wave, but still we are looking at those critical issues that would have been addressed in the first place.
Yeah, and of course that's what I was saying. You see, COVID has been a lesson, and every time we are learning. It comes as a challenge. It keeps changing. We have a new variant today. So we also keep learning as government, and that's why every time we learn, we come up with better measures of managing. For instance, I would say this financial year alone, and we agreed anonymous, all of us, every ministry and agency is having a budget cut of 40%, because the Ministry of Health, like we said, the ultimate solution to this is vaccination.
Yeah.
The Ministry of Health wants around 580 billion shillings to have vaccination with everything, all that it takes.
560.
580 billion.
80.
Yes, that's what they want to roll out vaccination for 22 million Ugandans. Of course, that's the target vulnerable population. And already, Ministry of Finance is okay. It's going to avail actually 600 billion this financial year. This quarter, as I speak, Ministry of Health has got around 206 billion shillings just for the first quarter. Yes, I know there are challenges of vaccines. Honestly, it's not only a Ugandan challenge, because the money has been there, but who is willing to give us the vaccine is a challenge. In Kenya, it is the same. In all over the African continent, because we've vaccinated few people. I think we are over. Yes,
it's 1 million.
1,100,000. But Kenya is not any different. It's around 1.6 as well. Rwanda is actually 500,000. So it's a general challenge, but I know that anytime soon, yes, we are going to get the 2 million Johnson & Johnson. We're expecting 9 million from AstraZeneca again. Yeah, so the challenge has been the availability of vaccine going forward. But government is this time is more committed to release all that Ministry of Health wants to have this pandemic in control.
All right.
Create herd immunity.
That would be important. But Ms. Fatia, that is the issue that has always come up, the issue of vaccines and the lockdown. Because, like you said in the beginning, the lockdown would have helped us to prepare ourselves, vaccinate the population, and get that herd immunity that would save us from the pandemic. And going to what Honourable Minister said, it looks like the government is saying there are no vaccines. There is no way we can access vaccines. But the public seems not to agree with that, that there is always a way we can get those vaccines. What's your take?
I think...
do you appreciate the response from government in that line of vaccines?
I think the message that, first of all, it's a positive thing. It's an important thing that government is coming out to update the public where we are at in terms of vaccine. Now, the government is giving us some good news in that actually the problem is not the money. Hopefully, indeed, it is not the money. And that's what we are getting from government. It is not the money, it is the source of the vaccine. I think that is not just a problem for Uganda. We know that the minister was on TV saying that, yes, indeed, we have even tried to go as a team of countries from Africa, really to have that bargaining power, but it's still a challenge. We know that the issues of vaccine and accessibility by the low developing countries is a global issue. It's been alluded to by even the WHO. So I think indeed there is a problem there. We can only hope and encourage the government to really continue engaging in the diplomatic relations. We have seen some countries giving us vaccines because of the diplomatic relations we have with them. So I think for me, the positive thing is, firstly, government is telling us the money is there. If we get the source, the vaccines will be here. Secondly, government is engaging in the diplomatic relations, and we are seeing that bringing some positive things to us. I think we are getting some vaccines through the developed economies because they have the vaccines and they are giving us some. We can hope that government continues to invest in those relations so that we get more here. Thirdly, I think the vaccine hesitancy. We have done well, and also the experience of the public of how aggressive and how unforgiving the pandemic has been in the second wave has pushed the public to realize that, yes, indeed, we need to get vaccinated. But we cannot rule out the fact that we still have vaccine hesitancy. As we wait, as the government continues to try and really do all it can to get the vaccines, I think the issue of addressing vaccine hesitancy is important. And that's what we should be doing now, getting the public to appreciate and to understand that the vaccine is okay, dealing with the myths and misconceptions. Yesterday I had a conversation with a friend of mine. She updated me on several people that have died that she knows, and she was attributing it to, oh, when they got the second dose, oh, this one got this. So vaccine hesitancy is a reality now. And I think it is the lack of information. I think for me, the focus right now, as we wait for the vaccine, the focus has to be information, addressing the people's questions, addressing the myths and misconceptions. And vaccine hesitancy is not just about certain communities. It is across all communities. Don't be surprised to find people with the PhDs having vaccine hesitancy. Why is it so? So I think for me, we need to now invest in that angle. Yeah. So that when the vaccine is here, I mean, then people go for it.
I think you're right.
But also, allow me, Apollo, to say that we are also not talking a lot about the reality of side effects. Let's be open. Let's do research. Let's do quick research for those who have got the vaccine. What's their experience? What are they? Have they got any side effects? Are they serious? Are they minor? That should help us with our communication around vaccines.
Yeah, I think, Ms. Fatia, you're right, because I envisage a situation where we can now receive vaccines, actually huge doses of vaccines, and then we actually don't see people going to take up those vaccines, because it happened in the beginning. We had vaccines here, but the uptake was very low. And towards the end, then people woke up to the reality that vaccines are probably now the issue that can deal with the pandemic. Can you briefly...
Maybe to comment on what Fatia was saying and what you're saying. I have people I know that have deliberately refused to take the vaccine as well. But I think it would be ignorance. If you people who watch soccer and the rest, I was somewhere in Nairobi of late, and people who are vaccinated don't even put on the masks. In fact, the only way forward for any country to get out of the pandemic, let's say me who works with tourism today, is vaccination. And yes, it doesn't give you 100%, But at least if you have the second jab, it will give you at least 90% of protection from getting even admitted to hospital. Those who die around probably 1%. Of course, you cannot say that everything will get well, but it is the only way out. It's happening in Europe. Guys are watching soccer. You saw recently the league that was going on, and these guys are in the stadiums, without masks, enjoying each other, and nothing is changing really. So I think for me, I just want to tell Ugandans that vaccination is the way forward, and there is no way out of it. Soon you will not be able to travel. Recently, when I've only gotten one jab, I'm going to get the second. But even when you're coming into the country with results, you have to retest again. So time is going to come when you cannot travel unless you have the 2 jabs, and so there is no way out. But I want to appreciate that the second wave was a serious lesson for Ugandans. By the time some vaccine came in, they were actually running to facilities to get the vaccine. So I believe, yes, like she said, we need to put out more awareness about the vaccine. There are no serious side effects, like I said. It depends on how it treats an individual as you are, but there is no serious side effect vis-a-vis the protection that it would give you. So we shall do more awareness. Of course, you as the media as well. People need to get these things really. The moment you have it, you're safer. You're much safer. If you don't have it, you're a good candidate of death at any time. That's true.
So Fatia, as we conclude on this particular matter, you are convinced that it is not about money, like government is saying. Funds are available, but there are no vaccines. You're convinced in that, with that?
The fact that it's not just Uganda complaining about the holding of vaccines by the developed economies, that one we know that the developed economies are really holding up the vaccines. That one we know. There is no doubt it's a global issue. So that I'm convinced that yes, indeed, there is an issue with the developed economies. In terms of our government saying the money is here, the money for vaccines is here, we are yet to see that. We are yet to see that. But then, of course, one would ask, a lay person like me, I would ask myself, so if the money is here, why is government appealing to the public to step in and contribute?
Honorable Prime Minister this week urged the public to come up and contribute.
Yes. So again, if even with that request, we should be knowing from government, okay, you're calling us to contribute, which is a good thing. We need that solidarity now, the way we had it before last year. What are the things that have deficit? That is accountability, that is being transparent. You come up and say, we have this amount of money for the vaccines, but we don't have this amount of money for this particular area, maybe for
oxygen.
Maybe for oxygen. So then the public will know. So I can't confirm to you that the money is there or not, because I'm not there. I'm not in government. I'm not.
No, we have an honorable minister here.
I've had just like you.
He will commit himself on that.
Yes, I've just had like you, but hopefully, but I've also, the foreign governments are also donating. They are donating significant resources towards the vaccine. That also tells me that yes, indeed, we have mobilized the resources. Our prayer is that these resources are put to the rightful purpose. That is really our prayer. And also the issue would be to how do we locally organize when the vaccines are here? How do we locally organize? How are we using this time to organize for that time? I want to also say something small on the vaccines, at least for the benefit of the public. I recently attended a webinar, a virtual one, and it was on clinical management of COVID and vaccination. It was organized by an organization that I worked for. It's the African Palliative Care Association. The speakers, the very senior clinicians, one of them is at the forefront in the US managing COVID. The other one is at the forefront in the UK. Now, what was interesting is the one in the US was saying, he said, I want to quote him, that I feel so bad because I feel so bad because it's Afro-Americans filling the ICUs and many don't come out. But then I see 80-year-olds walking out alive because they have been vaccinated. He further added that there is propaganda that the vaccines are really done by the Western countries to harm the Africans and other low-developing countries. These two Ugandans who are senior clinicians at the front line in COVID in the UK and US, one of them said that people should know that it is African PhDs behind these vaccines. It is African PhDs in the laboratories.
Really?
That was very reassuring, actually. For me, it was quite reassuring to hear that. So I think these are some of the messages we should actually be, we should all look out for this evidence-based information and bringing it out to the public for people to have
fight
confidence.
Vaccine hesitancy.
Yes, yes.
But just to add on what she said, and like you put her on the spot, to be honest, money for vaccine is available. Not only even for vaccine. You see, because of COVID, we believe that this financial year alone, there could be a shock within the economy where I would lose around 2 trillion shillings. And that is why government has deliberately done these cuts of every agency to even have this money prepared in advance for the next financial year, so that we don't have any setback. But going forward, so like I said, I also want to thank His Excellency the President. He has gone ahead to individually write to vaccine manufacturers. Please, we are begging you. Can you just consider us? So the challenge is really availability of vaccine. But even in Europe, if you go to countries like the UK and the rest, they're also complaining against these manufacturers. Actually, some of them are even, I think, floating on going to court over them because they've ordered the doses and they've only gotten solace vis-a-vis what they had agreed to get. So even them, there's a challenge. They are not getting enough for their people. So what of us, really, the Africans? But like she said, of course, I also want to thank government, especially His Excellency, this drive of having an African solution to most of our problems.
Yeah, that is important.
So we need to support these guys. We can make a vaccine. I know they are trying something here.
Even treatment.
Yes, even treatment. Like we have COVID today, and it is working. So let's not look at ourselves as the lesser human beings in terms of intelligence. And like she said, the Africans in these labs making these productions of these very vaccines we are taking. So let's empower people. And I think going forward, government should really, and I want to take them, like I said, commend especially His Excellency, because even goes out of where he uses his own personal budget to fund every kind of medication around this. So going forward, yeah, we should explore this. Let's sit down, have the right people here. Yeah, produce these vaccines.
Okay. Now, Honorable Minister, now as we agree that the funds are available, why are people still not convinced that you have, that there is will to get the, to treat the people, to get the vaccines? I think partly it is because of what she said, the issue of how the funds have been handled before, managed before, the issue of accountability. Do you admit that it's an accountability issue that is creating that misconception in the public that that the government is not actually looking at the issue of vaccines as that critical as it is really?
No, but Mr. Afro, you see, it's normal for public to doubt. Yeah, it wouldn't be new. Like we are talking about hesitancy from people, they don't want to get vaccinated. So I'm just, what I'm trying to
people
say,
are not convinced
what I'm trying to say,
that the money is there. Maybe
yes, and
they think that you're using this issue of developed countries holding onto vaccines as a scapegoat.
No, but you see, like I was telling you, let's say last week we had the summit about tourism recovery. We had around 20 ministers from across Africa. And I can assure you beyond doubt, these countries have money, but they cannot get vaccine. And it's not, I was just telling you about Kenya. Kenya has just...
But Kenya just got vaccines. I mean, I think is it last?
Yes, but Kenya has been vaccinated. It is a bigger country with a bigger...
Tanzania has received vaccine this week.
For Tanzania, let's not even talk about
okay, go right ahead.
But I can assure Kenya has only vaccinated 1.6 million people. You know, if you look at Rwanda, just 500,000 people. So it's not only Ghana challenge. For me, I want to assure you, I don't know why people are doubting. Well, people will say about let's say the 24 billion.
24 billion that was fundraised.
Yeah, but that's what I'm saying. You see, COVID is not only an issue, because some people are saying, why didn't you buy ambulances, why didn't you buy pickups? But you see, COVID has a lot of components in it. There is surveillance. There is so when you only acquire an ambulance, which actually is at the tail end of only transporting
the sick
from one. What of surveillance? What of monitoring? What of movement of samples? Not every regional referral right now has a PCR machine. I know. Yes, for also just go to one.
For testing.
Yes, for testing. So most of these guys still have to drive samples from the villages, from referral hospitals straight to Kampala. An ambulance cannot do that. So yes, I know. Basically, there's nothing we're going to do as government that is going to be so satisfactory in terms of handling COVID. And I don't think there's any country, be it the US or that has done it. We are just trying our best within our means. But I want to assure you, going forward, the public should not doubt.
Okay.
The orders for vaccines are there, like I told you. Thank God, and I want to appreciate the government partners because they are contributing. We are getting some doses, but we are not getting enough. Like I told you, we have had an order of 9 million doses that has been pending now, getting into 4 or 5 months.
Okay.
So it's a general challenge, but in the meantime, let's keep ourselves safe, put on a mask, wash. We survive in there.
We survive in there. It is the dialogue. My name is Simapolo, and the guests in the studios we have Honorable Martin Mugara Bahinduka, and he is the State Minister for Tourism in the NRM government, the ruling government, and we have Miss Fatia. I'm sorry for Chiange. Yes, Chiange, and she is the Deputy Executive Director, SEHUD, Center for Health, Human Rights and Development. It is a civil society organization looking at many other issues in this country. We have a few minutes to the break, but of course we are already looking into the priorities of this government amidst the COVID-19 pandemic. I think we have now delved already into the issue of priorities. He talked about the issue of the ambulances. It has been the issue, Ms. Fatia. People, a section of the public saying, how can this government at this critical moment buy double cabin pickups and not ambulances? Just in 3 minutes as we go into the break.
So you mean in terms of prioritization?
Priorities.
I think for me it is to balance the priorities, to get them right, to really get them right. When we watched the problem for India, we really thought it was far. But within a very short time, the shortest time possible, that problem was here. We saw the suffering in India. So, those indicators are important to inform prioritization. I don't know at what stage the pickups were bought, but should we say we just buy pickups alone, or should we balance? Should we know that, okay, yes, there is surveillance that will need pickups, but we'll also have fatalities that will need ambulances. We'll have fatalities. We'll have a severe illness that will need oxygen. We probably maybe 6 months ago we should have anticipated. Somebody should have, like, through surveillance and monitoring, somebody would have seen and reported that the oxygen plants we have in the regional referral hospitals, some of them are not fully functional. So that should have happened using the pickups for surveillance and monitoring to now identify an issue that the oxygen plants, some of them are not working, and then it would have been a matter of really making sure they are functional. But we are caught unaware. Even those that exist, we are not functioning. Why is that so? So for me, I think it's the need to the balance in terms of priorities. I don't know whether we are going to have a follow-on questions around priorities.
Yeah, we will.
But for me, I think prioritization is
still a
Uganda is not a poor country. And I don't even like calling Uganda a poor country. Our issues are around prioritization.
But Honorable, on that particular issue of pickups and ambulances, I noted somewhere Of course, we know it, but COVID treatment has not been decentralized to that level, where people in Gulu can manage their cases that side. We need transport. People need to transport patients to Kampala on many occasions. And one person actually in the news had to spend 3 million for an ambulance to transport the patient to Kampala. Don't you find it really unconvincing to buy pickups, not ambulances? Because even the issue of ambulances was on the floor of Parliament, I remember. The Prime Minister talking about it and the Minister talking about it. The issue of ambulances is still a challenge.
Yes. But you see,
and they cited, let me, as a follow-up, they cited a case of pickups, of DPCs having pickups, the RDCs having pickups all around the country, and what cows have pickups around the country. I mean in the countryside. And why buy pickups again and not ambulances?
Well, first of all, I would say even when the Prime Minister was speaking, she had ambulances were also participating.
But not.
No, yes, not as many as pickups, but they were. And if you look at most of these regional, because ambulances are managed mainly as a referral, and of course some districts have. So yes, it's not that ambulances were not bought at all. Yes, they were bought as well. But like we are saying, most of these cases are mainly in those lower areas. Going forward, you see, treatment is the last bit of it, where the ambulance companies come in. But I can assure you, surveillance, educating people. We are going to start a roll out a vaccination program. You will need this movement. You will need these vaccines closer to people as much as you can. We're not going to transport them in an ambulance. So we need as much as, because that is where government is focusing at really. The management issue vis-a-vis the treatment. Yes, we need the ambulances, there are challenges, yes, but like I said, some are
Do you remember a time when a minister came on the floor of Parliament and requested MPs provide ambulances? Can't we have ambulances at that level?
Yes,
really.
And that's why I'm saying equally private hospitals. We are partners in this. It's not only, it shouldn't only be a government problem. Vis-a-vis really, but because now, like I'm telling you, you can look at the budget for just the 5.8. If just an oxygen air plant that she was talking about, just one, we just need 15. But if you look at how much just one function one would cost us, it's in the billions of shillings, just one. So there are so many things that need to be done within the that we have. But like I said, the MPs have ambulances. Yes, private hospitals.
Few MPs.
Yeah, private. So we are working as a team, but I can assure you, we've been purchasing ambulances, and of course there are some that are already there, but they are non-functional. Yes, and government is also looking at equipping them, having them run efficiently again. But going forward, yeah, we shall keep. But I can assure you that even as pickups were bought, some ambulances were bought.
All right. Well, it is the dialogue, and my name is Timapolo. We have the guests in the studios. We are looking at government priorities amidst this COVID-19 pandemic. Are the priorities right or wrong? That is the big question we'll be answering in the next hour. We are looking at legislators being advanced 200 million each for vehicles, and that's where the question arises. Is it right? Is it morally right? Is it really right to advance those? I think it is around 108 billion Ugandan shillings to members of parliament buying vehicles at this point or not. That is what we'll address when we come back from this short break.
Soul Television, Femunyo.
A warm welcome once again. It is the dialogue, and my name is Timapolo. We have in the studios the State Minister for Tourism, Honorable Martin Bahinduka Mugara, and we have Miss Fatia Kiange, and she is the Deputy Executive Director, Sehud Uganda, and we are looking at government priorities amidst this COVID-19 pandemic. Are the priorities right? or wrong? That is the big question. And later on, we'll be looking at the government interventions, especially the COVID-19 relief support. This week, the Prime Minister, the Right Honorable Robin Anabanja, reported to Parliament that almost 83% of Ugandans have received the money. Is it so or not? That is part of government intervention, and one that has been questioned for weeks now. But of course, as we kick off the second hour, I need again to ask you one last time. Are we ready? What next after these 42 days, Madam Fatia? Are we seeing, from what we have said, from what we have analyzed it, are we seeing the lockdown lifted? What do you expect?
Apollo, it's a difficult question. I can't say the lockdown will be lifted or not.
It's a prediction.
Because I'm not the one to make that decision.
It's a prediction from what we've said, what we have analyzed.
I think I would have been in a better position to predict if I had information on how we have used the 42 days to prepare for the next step.
Okay.
If, for example, the next step was to open up, by now there would be a lot of indicators in terms of updates to the public.
Okay.
Yeah, in terms of what we have prepared. You see that? In terms of, so already these indications of the planning around each government sector would have already come to tell the public that this is how we are organizing the public transportation. This is how we are organizing this. This is how we are organizing schools. But we have not had that as a public. We have not seen these sectors come to update us on how they are preparing. So that takes me to think, for me the question is, I'm thinking, are they prepared? Okay. Are they not prepared? If they are prepared, I predict the president will open up. If they are not prepared, the president will not open up. But we can't know whether they are prepared or not unless they come and tell us that this is how we are organizing public transportation. This is how we are organizing this. This is how we are organizing this. Until I have such information, it's difficult to tell whether the country is going to be opened up or not.
It is very difficult to predict.
It is very difficult. If we had those updates from the different sectors, if we had those updates from the National Task Force on COVID, this is how within the 42 days, this is how we have equipped the hospitals. Within the 42 days, this is how we have empowered.
Did that this week in Parliament. She updated the country.
In terms of preparedness for opening up?
No. The progress.
I'm talking about opening
up.
I'm talking about opening up.
Honorable Minister, this question I raise it because people who have been in the lockdown for all this long are very anxious. And some actually very anxious to see what the president says, probably this week. And what do you expect? Just in an open question.
Of course, like I said, of course, I've seen somewhere where scientists are saying that for us to achieve a flat rate for some time, we'd need to get into the next month. I've seen when the proposal before the initial lockdown that you'd need the gap of but anyway, like I said, I don't know. I think it is, and it's important not to listen to the scientists as well. Yes, I know it's a challenge, really. People are not working, and all of us, our family members, our relatives, it's a challenge. But equally, life is also important. Life is also important. So let me pray, whichever way it comes. Like I cannot have a prediction.
You cannot have a prediction, but you have already received 200 million for the vehicle as a member of parliament, and as an ex-official, of course, they have also been given that money, that privilege of the 200 million. Do you think, in your heart of hearts, it is morally right to receive that money when actually there are other critical issues outside? like the issues we have highlighted, issues of oxygen shortages, issues of no ambulances, issues of COVID relief, food, people are starving. Is it really morally right?
Of course, now, you see, what would the argument be? Would it be that members of parliament are not entitled to vehicles?
They are entitled.
Or would you say that the timing was bad?
The timing, maybe.
Or would you say that, because for a fact, I think government has been, this has been happening since the CA. You know, it's not new to this 11th parliament. It happened since CA to date. Members of parliament have been facilitated with transport. And yeah, to be honest, there are some MPs who come without even vehicles to parliament. I would say the 9th parliament had a colleague who told me he campaigned on a bicycle, and when he got an RM contribution, he bought a motorcycle. But of course, all that aside, it's not only a Ugandan thing. In Kenya, they give, even in the East African, we're going to be voting on Monday for someone who will be replacing, may his soul rest in peace, Honorable Kasam. They get vehicles, really. So it is nothing new. And like I said, yes, we have a COVID challenge, but not everything will come at a standstill, really. Not everything. You need these guys to do the monitoring. They have a lot of pressures in their constituencies to move and all that. So yeah, it's not really news. It's not really news. And I
it's
think
not really news.
Legally, yes, I'm being honest. Legally, they're entitled.
Legally,
and it has been happening.
True.
Yeah. And interestingly, I'll just, for instance, I've seen journalists from the time, at least I've known a few things about MPs getting cars. You see, every time when they're still in the media, they'll comment about it. This is very bad, it is immoral. But now that we have colleagues who are journalists before, who are now in the house, you ask them why now they are not saying it's immoral after getting the money.
The same Uganda. The Muhanga, Honorable Muhanga.
No, I'm not saying, no, Honorable Muhanga has been in parliament. But there are so many that you even win. So you could be asking the question here, the moment you get to parliament, I don't think you'll come back here and complain about it. Because it's an entitlement, really. It's an entitlement. We can have debate about, well, how much it is. But you see, equally there was a suggestion that government should procure vehicles for members of parliament, manage them, have a driver for them, which I
like
think...
all other.
Yeah, but I think it would even be more costly. Yes, it's better you have something private, manage it on your own, but everyone has. Chairman LC5, entitled to a vehicle, the RDC has. Why not an MP, really? Why not? So it is something that comes with what they are doing. And we can have a debate that the money is too much, or the MPs are very many. But you see, at the end of the day, you see the Ugandans want constituencies every single day. Even where I come from, they want constituency divided everywhere. So really, we are creating these big numbers, and there is this entitlement. You cannot take away that right from the MPs. From
legislators.
I don't, because it has not started with us. It has been there since.
Yeah, true.
It becomes difficult. So it's not an issue of morality, immorality. It is an issue of it has been happening, and everyone has been getting. So why would it change today?
In the middle of a crisis.
Yeah, but like I'm saying, yes, there's a COVID challenge. I know. Well, maybe it could come subsequently. I know that the relief was not good enough. I was part of the team that monitored in Rwenzori. The 500,000 people. Of course, it's unfortunate some have not gotten because of a few queries, but I know fortunately they will get. So the 54 billion, yes, was just for municipalities and cities, targeting those particular people. Only those that were in employment before COVID. And because of the lockdown, they stopped earning. And I think there were specific categories to that effect. But subsequently, even the districts, every district received 150 million. Yeah, just
the local government.
Yeah, this time not for of course relief, but for managing
the pandemic.
There was some additional money for VHTs and village teams, at least to be getting some smaller 100,000 going forward. Municipalities got around 100 million each on top of the relief municipality. So yes, like I said, you know, going forward, we cannot do enough. Even if you said you're going to give 1 million people, still people will go. It will never be enough. But like I'm saying, government is doing whatever it is within its means to make sure that there is some, but not everything will come at a standstill because there is COVID really.
All right, let me hear from Ms. Fatia. A tabulation by the Daily Monitor puts the 108 billion monies extended to MPs to 7.5 million doses of vaccines. What is your take?
I think, like Honorable Martin has said, it is normal and it is okay for members of parliament to be facilitated to do the work they do in their constituencies. I think for me the problem is the timing. It is normal, it has been happening, and the public has had concerns around the amounts because, of course, the amounts are also coming from the fact that we have more than 500 members of parliament. That's a lot of taxpayers' money. But it is normal and it is okay to facilitate MPs to do their work. The issue is the timing. It is in the middle of a crisis. Moreover, the worst point of a crisis. If it was 2020, COVID wasn't that bad. But 2021, COVID is so bad. It is devastating. The needs are huge. Yes, the Daily Monitor put it to 7.5 million doses of vaccine, but government would argue that no, we have the money for the vaccine, which is okay. But shouldn't the MPs, I would have seen MPs as heroes and typical nationalists. If they came up and said, being in the middle of a COVID crisis, can we have that money reprogrammed for us to have the 42,000 beds in preparation for what is coming ahead? Can we have that money allocated to the welfare of the very stretched healthcare workers in this country that can't even treat their families when they get COVID? If the MPs had come up to say that, for me, I would have seen them as our heroes. And it's not that they would not get the vehicles, but it would be that they would come up and say, let us reprogram that money for this year. We are happy to get the vehicles next year. That would have definitely changed the way the public looks at the prioritization and the MPs in particular. Yesterday, I think it was on Bukede TV, there was an MP, I didn't pick his name, who actually came up and said, 200 million is not a lot. It's not a lot. It doesn't really buy a good vehicle. He actually added, I have 6 vehicles that are more expensive than than 200 million. And I was thinking, so why should taxpayers' money be given to him at this time in a crisis? Maybe parliament or government should come up and even kind of prioritize the MPs that do not have means. But if an MP comes and says, I have 6 vehicles, they are more expensive, why are you adding him a vehicle of 200 million when 200 million would be
at least buy food
would be relief fund for many Ugandans? Now, also looking at the 100 now, also for me that brings an issue of equity. Equity. On one side, you have identified Ugandans that are struggling. And that number is 500 Ugandans are not all.
It's just
that the resources are not enough. You see, what if you got that money, added it to the relief fund, and besides those that have had to withdraw from their work, you added the 42% Ugandans who are living below poverty line? Because we can't say that those that have benefited from the relief fund, the relief money, are the 42% Ugandans who are living below the poverty line. Is it true that COVID has not pushed them further? Is it true that COVID has left us at 42% of people living below the poverty line, or that figure has gone up? So for me, the prioritization, I think we still have to do a lot about it. We really have to do. And we are seeing stories of people dying in their houses.
Yeah. People collapse.
Because they have no food. You see, I mean, we are seeing some schools continuing as normal for students to progress. We are seeing others that are not progressing because of resources. Is that prioritization right? I'm not saying MPs should not get the I totally agree. It's their entitlement, and they do the work. They need the facilitation, but the timing, for me, the timing is not right. I think for me, it is okay. Honorable Martin said that each sector surrendered a percentage of their annual budget towards fighting COVID. That was a good spirit. I think it's the time for me. But
that is in preparation for the third wave if it comes. Also,
no.
And even the current, even the current, yes.
Yeah.
But for me, I think that's the spirit we need to go with. Yes, it was that sector. But okay, right now, is it a priority? Is it a priority? Can't the MPs say we can get the vehicles next year? Let us now focus on fighting COVID.
Let him respond to that question. Honorable Martin, is the timing right? And if you are the patriots that you claim to be, isn't it to look at the welfare of people who have been distressed by effects of the lockdown? Give them food, at least at this point. Vehicles later.
200 to...
okay, well, I would say that, you see, there is a budget for each sector every financial year. In the previous financial year, there was a budget for every ministry. Parliament had its own. And in that, there was a consideration for MP's vehicle in the previous budget. So it's not money that is being picked from anywhere. It was already in their budget. They've already had a 40% cut. There's no MP who's going to travel. There is no, all those things have been stopped. They've already surrendered a bit to COVID. But like I said, the money was already budgeted for. Unless you're saying that Parliament should surrender now, should be the biggest hero amongst all the unions.
Yeah, you always claim to be on the side of the people.
No, just a second, and surrender 60% of its entire budget. I think it would be unfair to Parliament. Unless you're going to say that even the other entities should surrender. But like I said, honestly, that going forward, the solution to COVID is vaccination. Ministry of Health came up with a budget of 580 billion. Government is even providing 600 billion this financial year. Those cuts are for this very financial year, not even the next. If need be, we shall even do it even in the next financial year. There is no problem. So like I said, it is not an issue of
vehicles wait?
No, that is what I'm saying. That is what I'm saying. You see, honesty is very key. This is an entitlement to an individual, to enable him do whatever work it is. Even, by the way, managing COVID. These are the guys who are going to go out there and do the sensitization we're talking about, create the awareness. He will not do it on a motorcycle all the time. So yes, I know. That's what I'm saying. You see, as referring to your colleagues, it is an issue of you'll only say it's very immoral when you're outside. But the moment, and for me, I wish my brother, if we went back and played videos of journalists who have maybe just joined Parliament now, what they would say then, how can an MP get 200 million, 150? Now they are in that very house. You invite them here and tell them, what happened? Why don't you surrender today? So it is more of it is part of the job, really. So like I'm saying, yes, it could look, but let's be fair as well. There's already been a cut. Money for COVID, the vaccination is available. And Ministry of Health, by the way, will keep coming up with the other, whatever it is, and government is willing. The President has even said there shouldn't be any debate. For instance, me, I'm from the Ministry of Tourism. For us, we survive on marketing. If you don't market abroad and the rest, it's a problem. But said no. That's and you can imagine vis-a-vis how much money we bring into this economy. Over 1.6, 7% of this budget. They said, I don't want any business. What we are doing today is handling COVID. So let's not look at it in the entitlement is there. All other government workers have cars. In my ministry, commissioners have cars. You tell me, all government departments have vehicles. Even for private institutions like this one, I know that some senior workers will have a vehicle. So why not an MP really? Why not an MP? So but honestly, with all fairness, I think they're entitled. And
They're entitled.
yes, that's what I'm saying. If it's going to be a morality question, bring it to all the Ugandans. Is there one who's going?
So you feel
is there, just conclusively? Is there one who is going to sell his vehicle to contribute to the? So I'm just saying, with all fairness.
you feel we have been targeted as a soft spot when other people are enjoying privileges, and now everyone is looking at Parliament surrendering this privilege. Do you look at it as being targeted?
But it's not new. It's not going to end today. That's why I'm saying, and that's why I keep saying. You see, the day you do that, you can even invite me here and invite some people. It is, but it's part of the job, really. It is part of it. Everyone has means of transport. Like I said, not every member of Parliament comes to Parliament with a vehicle. I can assure you beyond doubt. Yeah. Some come with nothing. And yes,
but what about those who have many vehicles, even much more expensive than what is being given?
That is what I'm saying. But you see,
should we look at an arrangement where we can say, now you, Honorable Katuntu, you have this, so a vehicle should not be. How do you look at that? Is it possible?
But you see, it cannot be selective. I don't know how you'd pick on this one who has and the other one who doesn't. No, that's upon the individual to say, me I don't need, probably. But I know MPs, they are buying ambulances. But some of them even get this money, and you'll see people buying ambulances for their constituencies. You just see this very moment now that the money has come in. You just wait and see. Very many will buy ambulances. Very many will go to the constituencies and do projects. So sometimes really, it's not that all of them use it for their own. As much as it's an entitlement, yes. But some really give back to
Ms. Fatia, maybe we are unfair to our legislators in Parliament, because even other officials in local government, in all other offices, are facilitated. Maybe we are not fair to these people. As I said, I totally agree that members of Parliament have to be facilitated to do their work. As I said that before, I'll say the same, that the problem is the timing. The problem is the amount. Now, of course, I've talked about, what about that MP that has 6 vehicles already? Yes, indeed, it's difficult for government to be the one to say you have 6 vehicles. But when we go back to the patriotism and nationalism... Wait a minute. We have an office of the IGG that records the wealth of our MPs. Yes, we do, but still you wouldn't hold them accountable because they have. But then, I would come from the angle of patriotism and nationalism. For God and my country, you know? Now this is the time for people to say, it is for God and my country. My country means my people. You see, if you are an MP, you have 6 vehicles. Your people you represent will know you have 6. And now you're taking 200 million. You see? Now, Honorable Martin said that some of them are taking to buy ambulances. This is where we are now crippling and disempowering our institutions. If the need is ambulances, it should not be that the MP buys. Let the responsible sector or department or minister of government be given the money to buy the ambulances so that it's not tied to an MP buying an ambulance. It's not the responsibility of the MP, it is the responsibility of government and that particular institution in government that is responsible for that the ambulances. But I also think that, Honorable Martin, you rightly mentioned that it is an entitlement. But it is also an entitlement for communities, for people in Uganda, especially those that do not have. It is their entitlement to have social protection. So
unless we are saying that some entitlements are more important than others. That means we are still saying some people are more important than others. If on this end, the entitlement, okay, we are focusing on prioritizing the entitlement of 200 million. On this end, we are giving 100,000 to a household.
Yes, so a household of
a household of not
people.
one person. When we know we have experience at treating COVID, even for those who can't afford, cannot be 100,000. What are we saying? What are we saying about equity?
And the justification for the 54 billion shillings COVID relief money was that there are no funds.
Yes.
That can give cover
even
a bigger population.
A bigger population.
Well knowing that there are very many people who actually are in need of support, of relief. But they say there is no money.
Each day I'm hearing people plead to the Prime Minister, and I'm thinking, should Ugandans plead? Today I had the border people in, I think it is Rubaga division, saying the ones in Kawempa Lake, Honorable Prime Minister, please, none of us in Rubaga division has got. Should Ugandans be pleading? Should MPs allow their voters to plead for 100,000? I think for me those are questions of equity. Those are questions of nationalism. Those are questions of patriotism. We don't need to teach patriotism. We need to teach. But sometimes we have to be role models. This is where our MPs can be role models. Members of Parliament have the power to ask Cabinet to reprogram funds the way the cuts have happened. So MPs, this is the entitlement and benefit of MPs. You can instruct government that, no, this year we are deciding that we reprogram this money and we get vehicles next year. I think for me that we need to take our Ugandan patriotism and nationalism to that level.
Honorable
It
Martin,
is through that we will win the people. It is through that we will address, you know, the anxieties, the doubts, the trust issues of the people. So for me, yes, indeed, the MPs should really have the vehicles. It's an entitlement, but we need to remember that also Ugandans have entitlements.
okay. Honorable Martin, now, Honorable Minister, now you admit that maybe your government got priorities wrong to appropriate only 54 billion for relief support, and you have other big allocations somewhere.
No, first of all, I don't admit. Like I said, you see, COVID is not going.
Was it fair?
I'm just saying. For instance, you see, COVID is actually a challenge. It's a problem. COVID is not going to be a solution that is going to change us into a first world economy or not. We are going to stay the same people. There will be those that will lack. There will be those that will work hard and earn something. There will be those that just sit and beg until the world comes to an end. So the status quo will somehow remain. These are just interventions vis-a-vis the current challenges. And to be honest, like my sister was saying, patriotism, morality cannot be targeted to only one group of people. Yes, I have not seen people who have brought auctioned vehicles and say now because anyone can be an example. It doesn't have to be an MP who has said now for me mine I am selling, I am taking 20 million to the
we saw them last year. We saw that.
To the relief fund. But you see, even these MPs in their constituencies, to be honest, are supporting so many families on their own. If I know you'll be at Parliament, the pressures that they go through, taking care of the sick. Some are even treating COVID patients. You see, they are doing all they can within their capacity. So it would be unfair to judge them only on the basis of an entitlement of a vehicle. Yet everyone else does have. Honestly, it would be. So the morality, let it not be only subjective. Yeah. Let it cut across. So then now you can say, you see this and this. But to be honest, a vehicle is a necessity to a member of Parliament. Because if you look at his role, and secondly, You see, like you're saying, in Parliament, you were there on Friday. You can see how many stand up, and of course they are not satisfied with even the 54. They are advocating on behalf of the interests of their people at any one time. In
the people now,
just conclusively, MPs will speak, like we are saying, the budget now. They are, of course, we want a bigger budget for health, we want this COVID of the way, we want thousands of ambulances, we want all. Of course, they speak to that fact. They budget, they appropriate, and they see these challenges as representatives of the people. So I want to believe that, first thing first, quite a number of them are by virtue of placement. The morality aspect is there. The feel for their voters is there by virtue of placement into that very position. And they are advocating at all times. The challenge is vis-a-vis the resources. Like I said, not everything is going to come to a standstill and we just focus on COVID alone. You need government to move. We need to raise the taxes. We need to raise the money. Like I was telling you, this year we're going to make a projected shortfall of around 2 trillion Uganda shillings. We need this money in the next budget to keep running. And that's why there are these cuts. So COVID is one component in an entire system, the entire economy. So you cannot only focus on COVID and everything else dies, and then tomorrow we'll have nothing to sustain the COVID problem. So I think let's look at it in a nutshell.
I think now, Honorable Minister, you appreciate that the agitation in the population, their concern may be, the genesis of their concern is that maybe you have failed, you have not done enough to lobby and to appropriate so that the priorities are right. Because, like we said, if you appropriate 54 billion for relief food, and then I think that's the genesis of this agitation.
And that's
you've not done enough in that line to agitate for a bigger basket for relief at this moment, maybe.
That's why I'm saying.
Because we have that powers.
Yeah, of course, going forward, really. I know there was a bit of relief in the first wave. This has been the second, and that's why I'm saying. You see, COVID is a learning process. We learn, we come up better, plan better, organize better, and have better solutions going forward. But like I said, budgets were already done for various ministries, agencies, and departments.
Supplementaries are normal.
And actually, that is why we are saying that at any one point, you see, because of the COVID issue, a supplementary can be brought on the floor, and they'll be funding for it, whether from health or from wherever. But anything to do with the COVID issue shall be handled and be given priority number one. So yes, I believe that, well, the money was not that much, but there is no single time money will be enough, even if you increase to. I was just doing mathematics the other day, that yes, 100,000 is not much. If we gave 1 million Ugandans each 500,000, do you know how much money that would be? You would have no activity next financial year. The entire money would have gone to. So that's what I'm saying. It's not enough, and COVID is not going to be something that changes us now into a people that is now probably either middle income. I know we're almost there, or first world economy. We shall still stay with our challenge even after COVID.
Okay, Madam Fatia, I think that brings the issue of no money here, and then another side there is money. It is still the issue of priorities or not? Because in other areas, money is available. For other sectors or for other issues, they say money is available. Money is not a problem. Is it again the issue of priorities?
Yeah, I think it's the issue of priorities. Let's start from the 54 billion for relief vis-a-vis the 105 billion. 54 against 105 billion. 54 for relief fund for the people. Vulnerable people. Not all of them, because it's just a small section. Remember, the 42% below the living before the poverty line, before COVID, may not be part of the vulnerable that have got this, because this one goes to people who have been working to get food every day. But it's 54 billion against 105 billion for vehicles. You see, but also now on the larger, going into the big picture, this particular year when COVID is worse, when we knew we are having COVID from last year, the health budget is only 5.6%.
Yeah.
5.6%. Now that is despite the Abuja commitment we made that we'll work towards having 15% of the national budget towards health. And we see our neighboring countries making some progress towards that. But for us, we are regressing. 5.6% is very abnormal at a time when we have an unprecedented pandemic. This is the only time Uganda would have increased the health budget. One would expect that the health budget this particular year, it is the first year we are having the highest. You get it? So maybe highest 8 to 10, or, you know, because also, but now, and I don't want to talk about budgets for other sectors, but I have to talk about it. Now, it is 5.6%. versus the security budget of 30%, which has
30%.
actually 30%. I think it has doubled. But now for me as a layperson and as a member of the public, what I see is that government has done very well. We are relatively stable. In terms of security, we are relatively stable. I might not know the other things, but maybe those other things could not give the security budget 30% against 5.6% when we have a serious pandemic like this for the first time. So I think it goes back to prioritization. We are relatively secure, and government has done a good job. We don't have any major insurgencies in terms of our security as a country right now.
As civil society, in that line, do you find an area where you need to intervene and demand for amendments anywhere, speaking about the issues of privileges that are given to some people, not only MPs at this time, but looking at the whole picture? Do you see where you can come in and push for law reforms somewhere?
I think we are talking about it. Prioritization. I think as civil society, we really want to, we want government to think about these priorities more critically, to think about the people of Uganda, the majority of Ugandans, and thinking about them means getting the priorities right. I know what is happening a bit in other countries. I know a lot that is happening in a country like Canada. The country almost put everything aside to focus on COVID, but not just COVID. This is the time. COVID has only exposed the weaknesses of our social systems, including the health system. So then we should pull resources, all resources that we can, to strengthen, to try and have more resilient social systems, more social health systems that can cope with this magnitude of a pandemic. We may not get it right now, but we should show concrete actions and steps towards that.
All right. Honorable Minister, we only have 5 minutes, but you can utilize 3 minutes. Give the public assurance that probably things will change for the better.
Actually, just to contribute to what Fatia said, like I said, you see, there are so many components involved. It's not only COVID. You need agriculture. People need to cultivate, continue eating. You have security as well. That you saw what just happened with General Katumba. Security is a key component, and I think the security budget is only getting this share for only the next 3 years. Then we shall have, because of issues that not everyone would easily discuss. But trust me, it's in the interest of the country. The moment we have stability, the more we shall have investors, the more we shall have jobs, the more. So yeah, so going forward, so much is involved. But still, you see, it's the budget for health now is not still 6%, because we have contributed a lot now from all the other sectors.
These appropriations.
All these are now to health.
The cuts.
And yes, and there's even an opening that at any one point they can come and seek a supplementary budget. So COVID is a priority. Yes, at budgeting then, before this wave, no one anticipated that would have such a challenge. But now that we've seen it, because this has happened during the financial year already, so health is getting more, and of course I just pray, and that's why I keep saying, call upon Ugandans that let's stay safe, continue sanitizing, wear masks, avoid the public, and then we shall have this issue come down. But the assurance to Ugandans.
You sit in cabinet, you can raise these issues and things may happen. You never know.
No, but you see, I don't even need to raise them. Right from the principal, who is His Excellency the President. It's a priority. And that's why I'm saying he stood there and he said, I don't want any debate on the 40% cuts. Doesn't matter. Even if it is Ministry of Health, for your information, if it's going to do new constructions and what, no. Let's first focus on the problem at hand for now. Okay. So it doesn't need my effort. It is already within the principles, you know. By the time he's writing individual, even calling private companies, please, we need some vaccine. What's your consideration? You see how he's supporting COVID-19, how he's supporting all these scientists that are coming up with anything that really can have this bad situation in check. He's doing whatever he can. But going forward, I just want to reassure the Ugandans that government is doing whatever it can within its within what it can manage. Uganda is still Uganda. We have a limited budget of so little. COVID is not going to increase it in any way. It's just going to take away from what we have to see that we survive and all sectors keep running within our means. But government is committed in whatever way possible, and I want to commend the Minister of Health. It has done a good job. It's still doing a very, 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 very good job, and hope that going forward, my prayer is we don't get into a bad third wave. But even if we did, like I said, just for this quarter alone, we are fairly prepared. From 3,700 beds to around 10,000 in just this quarter will be a very big improvement. We are now importing, I think, around 6,000 oxygen cylinders. Probably 2,000 will be here in the next few weeks. So at least we shall be more prepared. Okay. But we don't need to get there. The trick is simple. Let's stay safe as government rolls out a vaccination program. Of course, as we are waiting for vaccines to create herd immunity for us to survive.
Thank you. Your parting shot. We are running out of time.
I think my parting shots, really, I want to speak to the key priorities that really should be priorities, truly priorities. One of them is health. It's already a priority, yes. But even within health, there are areas that are not catered for. There is a lot of mental suffering of the population, a lot of mental suffering. We need to invest more in mental support. We have psychiatrists in this country, we have social workers, we have psychologists. Can we mobilize them? Because before we know it, we are going to have a sick population, a depressed population. And if it is depressed, if the population is depressed, productivity will not be there. The taxes, I mean, the whole social development goals will not achieve. For me, that is number one. We need to prioritize other conditions. Right now, there is a problem. When you go to many hospitals, there are no patients. There is a reason for that. We need to investigate it and make sure people are going. Social welfare for people, Ministry of Gender, I think COVID has made us learn. Can we document the people who are below poverty line so that next time we do better? For me, I think the bottom line, let's take the lessons to each of us, do our part and strengthen the social systems. Finally, the government has a responsibility, but also as individuals and families and communities, like Honorable Martin says, we have a responsibility for our health. It starts with us and it ends with us also.
All right, thank you so much, our viewers. The dialogue is coming to an end, but I have to give to thank our guests. Honorable Minister, thank you so much for coming.
Just as we close, I know, let's pray that there is an opening And I would like to call on to Ugandans that as soon as we are open, let's come visit those good, there's a lot this country is offering. Yeah, we shall do more promotion, get involved, and see how beautiful your country is as you raise some money for the development of your country. True.
That is important. Thank you so much, Honorable Minister, for being part of this show.
Thank you, sir.
Thank you so much, Ms. Fatia, for being part of the dialogue.
Thank you,
Thank
you, sir.
Thank you so much, our viewers. The dialogue is coming to an end, but we will be back next week on Saturday. My name is Simapolo. Let's look at these issues and see if government now makes some changes in the priorities that we have highlighted this morning. We must say that you've been a great audience. We wish you a splendid weekend. Good afternoon and bye-bye.
Soul Television, Femunyo.
Lukemu 28 awo nayingira omumwe akoko kake ngame kaliko enjiri empitirivu osobola okugenda n'olinda omulimu paka ssaawa ng'emu eyakusuubiza bw'abanga asazeewo okusiba nga yeegalidde mu ofiisi